Hello again, anatomy students. Today we're going to continue our talk on the cardiovascular system. I brought my friend here with me today, and so we're going to go ahead and look a little bit closer at a couple important features of the heart, and so those would be the chambers and the valves. And so there are 4 chambers, and there are also 4 valves. And so what I'm going to do, sort of Indiana Jones style, I'm going to do a kalema. I'm going to go ahead and take off my assistant's lungs, and I'm going to go ahead and pluck out, ooh, here we go, ooh, the heart. Yes, ooh, I popped out the heart. Ooh, this guy's not going to last too long, sorry. All right, and so I'm going to use this to help us illustrate what I'm talking about today with the chambers and valves. If we were to look inside of the heart, we're going to see, take that off, and you'll see that there are exactly 4 different chambers of heart. So 1, 2, 3, 4. So there are 4 chambers of the heart. And so the chambers we have, of course, when you look at an anatomy book, you have to remember that the left side is the right and the left is actually, the on the right is the left. So it's mirrored. So again, don't get confused about that. All right. On the right side, we have 2 chambers. And so we have the right atrium and the right ventricle. On the left side, we have the left atrium and the left ventricle. All right, and so the upper chambers, which are known as the atria, which is the plural of atrium, have thin walls and receive blood returning to the heart. So notice, because they have thin walls, the muscle doesn't have to be as intense, it doesn't have to be as beefy, and therefore there's no need to make it any bigger than it needs to be. However, the lower chambers, and so if you were to look down here, if you were to look here, you'll see that these are very thick compared to the ones up here. And so the reason for that is because the ventricles receive the blood from the atria, so they go a very short distance, and then they have to contract in order to force the blood out of the ventricle heart and therefore into the arteries. And so it's important to understand then that these walls up here, the atrial walls, are thin because the blood only is going a really short distance. These down here have to be very beefy because they're pumping blood through the rest of the body. And so if that's not intelligent design, I don't know what is. All right. We're going to look at the 4 types of heart valves. And so we have them illustrated here and here and here. And so we're going to end up here as well. And so what we're going to have you guys look at, so we're going to first start with this one up here. And so we have what's called the tricuspid valve. Remember, the prefix tri refers to the number 3. A cusp is a point. And so where you might have heard this before is in relation to your teeth. And so when you think about your cuspids, those are your teeth toward the back, and they have these little points on that. And then the teeth do help you start the process of digestion before it goes into your stomach, where then it can be used to extract energy from the food that you eat. All right, and so the tricuspid, remember 3, we find this at the opening between the right atrium and the right ventricle. And so its purpose is to prevent blood from moving from the right ventricle into the right atrium during ventricular contraction. So the major point of all these valves is to prevent backflow of blood into the preceding chamber. And so we always need to make sure that the blood is going in the correct direction. And so we need to keep that in mind. All right. We also have the pulmonary valve. And so the pulmonary valve is going to be this one right here. And so what again does pulmonary mean? That's correct. It does in fact mean lungs. And so pulmonary is referring to the fact that this is going to be found at the entrance to the pulmonary trunk. It's going to prevent blood from moving from the pulmonary trunk back into the right ventricle during ventricular relaxation. So notice this would be our right ventricle down here. Our lungs are going to be on either side here. And so this valve right here, this valve that I'm pointing at right here, is going to be your pulmonary valve. All right. I want to now turn your attention toward the mitral, also called the bicuspid valve. Again, the prefix bi now refers to 2. Remember, cusp refers to the point. If you're to look at this valve up close, let me see to turn it, you'll see that it does in fact have 2 points. And so I do want to bring up a very interesting little story. The reason this is called mitral valve is because anybody who knows the head of the Roman Catholic Church is the Pope, and the type of hat that the Pope wears is called a mitre. And so when the anatomists were first looking into the heart, they found this valve, and if you look at it in this sort of way, does it not sort of resemble a Pope's hat? And so, again, there's no reason that science and religion can't complement each other. And so, just want to point that out. All right, the mitral, the bicuspid valve, if we look here, it's located between the left ventricle and the left atrium. And again, it's going to prevent blood from backflowing. In this case, it's going to be specific for the movement of blood from the left ventricle into the left atrium during ventricular contraction. I also want to point out, notice that the tricuspid valve and the bicuspid valve, mitral valve, both play very similar functions in the heart. So notice that the tricuspid valve separates the right atrium and right ventricle, and the mitral bicuspid valve separates the left atrium and the left ventricle. So they both serve the same function. So here's the tricuspid with its 3 points, and then the bicuspid with its 2 points. All right. Finally, we also need to talk about the aortic valve. And so the aortic valve is this one that's kind of tucked in. It's tucked in right here. And so the aorta, which is located right here, is in fact the largest artery of the body. And so obviously very important. And so we find this particular valve at the entrance to the aorta. So it's going to be right here. And so it's going to prevent blood from moving from the aorta into the left ventricle during ventricular relaxation. And so notice that the pulmonary valve and the aortic valve complement each other as well, because notice that these are both occurring during ventricular relaxation. And so those are the 4 types of heart valves. All right. This would be the figure that's going to be on the test. And so I would, of course, provide you guys with the word bank. And so I'm not going to go over all of the features, but I do want to point out a couple important ones. And so, again, the major artery in your body is the aorta. If you think about a mirror and you think about cutting yourself in half, as it were, you have a right side and a left side. Your heart also has a right side and a left side. But again, remember, it does flip when you look at an anatomy book. So it's as you're looking at somebody else and you're trying to know that his right is your left and your left is his right, and so on and so forth. All right, we have the superior and inferior vena cavas, and so those are going to take blood back from the body into the heart, and so the superior is for the upper part of the body, the inferior is for the lower part of your body, and so we also have obviously some important muscles that help to keep the heart pumping. We have the middle part here, which is called a interventricular septum. So remember, this little piece in your nose here, this little cartilage piece inside, is also referred to as a septum. It serves the same sort of function. So it does, in fact, serve as a separation between the 2 parts of the heart. And so, again, this would be the figure that will be on your test. But again, I would provide you guys the word bank in order to do that. So if you guys want to go ahead and take a moment to pause and look at this video, you can go ahead and do so. And remember that I will provide you guys the word bank for this particular test. All right, and so, in fact, I will bring it closer just so that it's a little bit easier to read. And so if you want to go ahead and pause right here. All right, good. All right, and so now we're going to move on, and we're going to talk now how blood moves through the heart. And so on the test, there will also be a fill in the blank portion where you basically have to show how the blood first enters the heart into the right atrium and how it is then pushed through the right ventricle and the tricuspid valve opens up. And so I want to first of all show you a picture of what this looks like. And so the next slide, which will be the last slide for today, will also give you an account of how the blood flows through the heart. And so let's go ahead over the steps. All right. So the numbers here are referring to the steps in the last slide. So once I'm done with this, if you want to look back at the previous slide, and therefore you'll see why those numbers are marked the way they are. All right. When your blood is out of oxygen or deoxygenated, it's going to come back through the superior vena cava, 1, and inferior vena cava, 2, and will enter the right atrium. So remember, the vena cavas will take up the blood from both parts of your body. And so the first place that the blood goes to when it's low in oxygen and high in CO2, it'll first enter the right atrium. All right. The right atrial wall will contract. The blood will pass then through the tricuspid valve and then enter the right ventricle. So remember, the tricuspid valve, the 3 cusps, the 3 points, prevent the backflow of blood from the right ventricle back into the right atrium. And so that would obviously be a very bad situation. All right. The right ventricular wall will then contract, and therefore blood will then pass through the pulmonary valve and through the pulmonary arteries to the lungs where CO2 is exchanged for O2. I want to point out this is a very important exception. Normally, when you're talking about arteries, arteries are the blood vessels that contain the oxygen-rich blood. The veins are the blood vessels that contain the oxygen-depleted blood. The only exceptions to this are the pulmonary artery and the pulmonary vein. So notice the pulmonary artery, even though it's called an artery, it doesn't contain oxygenated blood. So this is the only exception. Every other part of your body where there's an artery, you can know that it's carrying the oxygen-rich blood to those parts of the body. The only exception to this would be the pulmonary artery and then naturally the pulmonary vein. So the one that brings the blood back from the lungs into the heart. And so that would be the pulmonary vein. So that's the only exception to the artery and vein rule. All right, just wanted to point that out. All right, the CO2, as I mentioned, is exchanged for oxygen. And so it's important, obviously, to remember to breathe. And that's why they tell you when you exercise, it's important to breathe, because you want to make sure that your tissues are getting the right amount of oxygen. All right, the freshly oxygenated blood will then return to the heart through the pulmonary veins. So again, remember, that's the exception to the rule. So this time, these actually have oxygen-rich blood, whereas everywhere else it would be oxygen-depleted, and will then enter the left atrium. And so notice the blood always goes into the atria. So depending upon if it's the vena cava, it'll go to the right atrium. If it's coming back from the lungs, it's going into the left atrium. And so that's where that's going to happen. All right. The left atrial wall will contract and then enter the left atrium. It'll go through the mitral valve and then into the left ventricle. And so remember, the mitral valve is also called the bicuspid valve because there's the 2 points. And so this is going to prevent the backflow from the left ventricle back into the left atrium, so that's going to keep that from happening. Finally, the left ventricular wall contracts. The blood passes through the aortic valve into the aorta and then onto its branches. And so again, just to sort of recap, we have the superior and inferior vena cava. The blood is going to come back. It's going to enter the left atrium. The left atrium is going to get, the blood's going to get squeezed down into the left ventricle. It's going to go through the tricuspid valve. This is then going to contract. It's going to force the blood then up into the pulmonary, through the pulmonary valve into the lungs. The CO2 is exchanged for O2. The O2 then comes, the oxygenated blood comes back down here. And so it goes back into the right atrium. The right atrium, then the atrial wall contracts. It's going to force the blood into the right ventricle. And so the mitral valve, the bicuspid valve, is going to keep that from happening. And then eventually what's going to happen is it's going to then get pumped into the, through the aortic valve and out the top. And this, again, remember, is the aorta. So this red thing right here is the aorta. And so remember, your body is doing this 7,000 liters per day. And so, as you can imagine, your heart is a very, very important muscle. All right, we're going to stop here for the day. And so I hope that you guys had a little better understanding of both heart chambers and valves and the way that blood passes through the heart. And so I will talk to you guys next time.